Hi, I'm Govinda. I'm a qualified pharmacist, so I work in the healthcare profession. And I've had Invisalign done. The reason why I did Invisalign was the fact that I wasn't confident with my teeth. I was really conscious about the way they looked, and me being in the healthcare profession, I talk to the public a lot. A lot of patients come in, to my peers, getting my message across. I didn't really feel comfortable with the way my teeth were. But also on the other side, I didn't really want to have braces with the metal train tracks, as they call it. Was also not really an option for me because, again, that was the fact that they were in my mouth, and I didn't want, at my age as well, I didn't want people to really see that. So I decided, when I went to my local dentist, Dr. Tony Tank, basically showed me Invisalign, and he showed me the fact that no one would ever see them in your mouth. So, you could carry on, do what you wanted. The fact that it was so thin, so glued into your teeth that there was no excessive saliva, there was no spitting, or my voice wouldn't change. The fact that, I wouldn't even probably feel them that they were in my mouth. Next step was to set up a consultation with Dr. Tony Tank, and basically took it from there. When I got to the consultation, he explained to me in detail what I needed to do, what it was about. He showed me a model of what they looked like. So they were really thin, so even when they do go into your mouth, you can hardly feel them. So it was pretty much perfect plan, really, over train tracks, the metal ones. I could eat whatever I wanted to eat. I didn't have to stop at, I could eat caramel, I could eat hard things, soft things, anything I wanted. As long as I brushed my teeth before I put them back in, didn't have to change my diet or anything. The other good thing was I wasn't seeing Dr. Tank every 2 weeks. If I didn't need anything doing to my teeth, he'd give me 3 or 4 sets of dentures, and I'll just take them away with me, and I'd see him in 6 to 8 weeks just to check up on them. If I had any problems, I could give him a call, or he'd fit me in straight away. If I did have a problem, he'd literally come down the next day, because these consultations are like literally 5 minutes, so they don't take much of your time. He fits them in, so that's good. I was seeing him late. I was seeing him almost 6:30, sometimes 7 o'clock, and he'd fit that in really well. I was really happy with them, to be honest. My peers, public, no one noticed. Even when I told them, they were so shocked that, they thought they were just normal dentures, that they weren't braces. And I was like, no, these are actually moving my teeth. And that they saw over the weeks and weeks that basically, they are doing the job. And a few people have asked me for recommending, so I recommended a few people doing it. After a month or 2, you really start seeing changes, and I was really happy with that. When we were having a discussion with Dr. Tank, my main issue was just this one tooth. That was it, really. I just wanted that straight, wanted it to come in line. And he said that's fine, but he also recommended me to change a few things, and we went through a few steps. He showed me how it looked, send it off, get the results back, and then you tweak a bit more. This was before the treatment started. And basically, he was happy with that. And now looking back at my treatment, I didn't realize that the other teeth were so not in line, so offset. I didn't realize that, I thought they were straight or straight enough. But now looking back, and when he goes through the timeline, they're so much more straighter than what I really wanted, to be honest. So he didn't only just change that one tooth, he changed my whole teeth structure, and in such a short time, I was really impressed with that. And the fact that it was literally painless over the such and such months, I was really happy with that. My smile was a lot wider, my teeth were a lot straighter, and now I'm really happy with what I got.